So so we are live and we are going to record. Okay, so we are live and we are now recording. Okay. Hi, everybody. Welcome to another episode of Life with Akia Live. Today, my guest is Dr. Thomas Hudson. He is a medical doctor, radiologist. He's written a book. He's in the process of writing another book. And he does something really remarkable and incredible. Not only is he a medical doctor, but he is so highly intuitive. He's one of the most intuitive people that I've met, and I have met a lot of intuitive people as well as trained a lot of them. But Dr. Hudson, he just has this remarkable gift that he has been able to blend with his medicine, his writings, and his work overall when he helps his patients. So without further ado, let me introduce you to Dr. Hudson. How you doing today, Tom?
Hi, Kia. I'm good.
Now that we figured out all the technical stuff.
Yeah, now that we got that passed.
Oh my goodness. Yeah. So tell me a little bit about yourself, Tom. Did you always want to be a medical doctor, or that was something you kind of got led into?
I just kind of got led into that. I wanted to be a professional baseball player, me and a million other kids.
Okay.
And, I went to college. It was a phys ed major because sports meant a lot to me. And I wanted to coach and all that. And I had to take biology, biology for poets, anatomy for poets, basically is what it was. And it sort of blew me away I just saw deeper stuff there. It was like, hey, this is designed. I don't care how long you think it took, or none of that matters. But it was like, it just was so magical. It really changed my life, right? And so I switched majors then to biology, and then this and that, and then and I ended up applying to med. Like at the last minute, I thought, hey, I got good grades. I don't know what I want to do exactly. So I was able to get into a medical school. So it was just sort of happened. It wasn't anything I ever thought about when I was a kid.
Mm-hmm. That's interesting, because I went from being a major surfer to a dance major to taking a class in kinesiology, the movement of the body. So it was like a lot of anatomy and all of that. And that fascinated me. And from there, I went into acupuncture in the healthcare field. So it's kind of interesting, that parallel, that I was way over here, I never even took a biology course in high school or anything. My first one was in college. So it was a really interesting, bent from this theater arts and dance and doing all of this performative stuff, and then moving into medicine.
It is interesting too, and it's the parallel. It's that because of sports, and I loved sports, and the thing that drew me into phys ed was to coach someday, but also kinesiology. How does the body work? When you exercise? How do you know where your hand is when you put it out? It fascinated me. But
I was fascinated by that.
The early part of phys ed was not that.
Mm-hmm.
It's not enough time to go into it, but it was kind of boring, honestly. And I couldn't hang in there long enough to get to the advanced kinesiology courses. So I switched into the anatomy, physiology. Oh, even the plants fascinated me, right? Even botany. I mean, just life and how it's constructed. And the deeper you look at it, the more magical and honestly unexplainable it is.
And what I see is all the connections. Like when you're looking at, you start to see how all these various pieces connect together and how they actually work together. That stuff just fascinated me also. It's
fascinating, and they look deeper and deeper, and then we know this, we know that, and then you get to a place, it's like, we don't know anything. We don't. I mean, they don't know how the trees. I got A's on all those tests, right? The xylem, the phloem, all that other stuff, right? And the trees, you can pinpoint it all and name it all. But how the water gets from the roots to the top of those trees, 200 feet, they don't know.
Yeah, wow.
They don't know. Like a surgeon, I've had let's say, well, surgeons or ER physicians, they don't know why a wound heals. They
Wow.
know all about the cytokines and the chemicals and the inflammatory things that are released. They know if you suture it together or if you steri-strip it, they know how to handle it, but they don't know how the body does it. They have no knowledge.
That
They
is
don't cause
amazing.
it, they can manage it.
Mm-hmm. I'm like what you're saying really floors me because I came to the same conclusion. The more I work with patients, the more I see clients, the more I think I know is the more I realize I really don't know. That's just like a speculation or a theory of why we think it's doing that, but what makes it actually do that? You're so right. We really don't know.
At the end of it, it is always a mystery.
Mm-hmm.
At the end of it, that's how, like in the breast imaging, which is what I got into, I can tell that I'm really an expert at it because I know how much we don't know.
Mm-hmm.
I mean, it's not that we aren't expert at it and can do amazing things, right? Compared to 30 years ago.
Yeah.
I mean, we're just doing incredible things. It's incredibly advanced on a micro level, but on a macro level, there's so much we don't know. I mean, every time you answer one question, you get two more questions.
That's true.
Pretty
So,
much literally.
so when you were telling me about a scenario when you were in medical school and they would hold up the X-ray or whatever imaging that you had to look at, and
Mhm.
you'd have to describe it to someone with their back turned, and you realize that you were using your intuition. We were talking about that, and you said, all of a sudden I realized I was using my intuition, like I could see it and describe it. Tell me about that.
Yeah. Well, in radiology, I just was in. I initially wanted to be a surgeon, but I got treated better in radiology, and it was more interesting to me. So I just slowly sort of put everything else to the side and decided, no, that was definitely it. So I was always fascinated by how they could look at a picture, right, a chest X-ray or whatever, and know all these things. I was just blown away by it. So the scenario was this is twice a day. We'd have conference. All the residents would be in a room. You'd sit there. The staff person would go, okay, Dr. Smith, here you go. Here's a case. So Dr. Smith would stand up in front of everybody in the room, and they'd put a case up. And now usually they know what our level is. So they know what's an easy case, and what's a hard case. So they'd put the case up, and, we'd stand up and look at it and go, oh my God, I have no idea what this is. And then you work your way through it, but that's part of the teaching. Okay, when I look at something and I don't know what it is, I look at the heart shadow, heart's normal. Okay, that tells me something. It's male or female? It's female. Okay, that tells me something. So they really taught us a way to think, but we would work our way through, and then we could come to a pretty close to a diagnosis over a couple of years. When you learn a lot, you can just look at a picture, ask a couple of questions, you just know. But what you were talking about is one of our professors liked to do was they put a case up, and then they took a first-year resident who knew practically nothing, and they would sit us in the chair, and we would see the image, and they would take a senior resident who knew a lot, and they would stand behind us looking at the back wall. And it was my job to describe what I was seeing. So like, okay, the heart is normal, and the heart's normal. The interstitial markings are a little bit up in the upper lung fields, normal in the lower lung fields. There's no infiltrate. We got all this stuff we go through. And the idea was that I could describe it well enough that the person behind me could make the diagnosis without ever seeing the image. And it taught me a lot. Interestingly, we all laughed at the staff person. We thought, oh God, you got to be kidding me. Here we go again. This is so stupid. But but here I am, decades later talking about it. And I think that was brilliant. It was brilliant because I don't have to know anything to be able to describe and to know what's important to describe and paint the picture, right? Now that I look back, I realize I was painting that picture. I wanted to transfer that picture on the image that I was seeing into that guy's head. That was my job. And if I could do that well enough, then he could make the diagnosis. So I never really forgot that, because even through my whole career, and even now, I pay great attention to my reports, right? I read x-rays. I mean, I read breast images now exclusively, but over my career, I've read it all. And I pay great attention to be really detailed on my report and choose my words carefully. And I never lost that lesson that I'm painting a picture with my words. Ideally, if I use the right words in the right way, then this person now it's halfway across the country, but it could be in an office across town, can get an idea, at least some idea of what I'm seeing. And I guess that has always fascinated me about radiology. I guess that's why I just fell into it, and I just seemed to fit it.
Do you believe that this was like a natural inclination that you had? And the reason why I'm asking, I have taught hundreds of people have come to me to get intuitive training. And I remember when I met you and we decided to do some intuitive training with you. And I have never had a student who was as detailed as you were. I was like, you were, like when you look at someone's, whether you're looking at their energy field or you're looking at some aspect of their life, you would go into the most minute, like you said, painting this picture. You would go into the most minutest details. Like I said, and I was like, wow, go see Tom. If you want the real details, go see Tom. Because most people say, yeah, this and this and this is happening within your life right now, and it's going to be fine. And, but you go into the reasons why and what it looked like. And, so I'm thinking, was this just a natural tendency you think you always had, maybe when you were younger, and maybe this professor or this staffer brought it out? Because it really showed up when you do work with people intuitively also, Tom.
I think it's probably something I always had, and so we've talked about that before, about, do you even know that you have it? Do you know what it is? Right.
Yeah.
I don't think I even knew what it was, or that I had it. I remember you telling me about my, intuitive ability, and I would go, yeah, okay, it's interesting. I guess she's right, but I'm not feeling it. Do you know what I mean? And then I'd go back to my medical job and just do my job. So in a lot of ways, I'm only starting to really believe it, do you know what I mean? And appreciate it now that I'm not as heavily into the medical. I work from home, so I'm not at hospitals. I'm not in that energy field all the time like I used to be. I remember my mom saying something, I don't know, I was an adult, and I don't know what brought it up, but she said, you were always good at puzzles. And I just thought, she said, even when you were little. And it's like, that's interesting. Maybe I was 30 when she said that. And I thought, that's interesting. I never heard that before, and I never thought about that. And what I realized was radiology, looking at the images and coming to a diagnosis, or at least coming to 2 or 3 diagnoses that a clinical person can go, oh yeah, I have the labs for that, right? They can take the last 3 and they can get a diagnosis. I can't always diagnose something, but I can cone it down to a funnel of 2 or 3 for them. But it's basically solving puzzles like all day.
Yeah, it is. Like, I always look at it as like doing detective work.
Yeah.
Like someone said to me, what did you want to be when you were a child? So I was an only child. So, the TV was my babysitter a lot of the times. So I said, I'm going to be like those people. I'll be on TV. I'll be like a movie star. But I didn't have any specific thing. And they're like, well, what exactly do you like? And you're not going to, I told everybody, I said, I want to be a thief. Because when I was a kid, there was this show called It Takes a Thief
I
with
remember
Robert
that.
Wagner, but then
Yeah.
he was a spy. I didn't realize as a kid because the title of the show, It Takes a Thief. So
Yeah.
I just thought, oh, he's a thief. I want to be like him. But then what I realized it was that he was a spy and he was always trying to solve problems. So, and then my other favorite show was Columbo, the detective. So it makes sense that, you know, like a lot of the work that I do is like going in there and finding out the secrets and finding out, you know, acting like a detective and finding out what's going on. So, you know, I never thought about it until someone asked me the other day and I said, why did I want to be that? And I remember crawling around the house with a little flashlight and opening up drawers and trying to pretend I'm taking little pictures of documents. I remember doing all of that stuff. I didn't understand the concept of the show as a small child, probably like 6 or 7 at the time, but it fascinated me, you know, and he always got out right before somebody came in the room, you know, those types of things. And I didn't realize it had to do with using that part of the brain, that kind of analytical, going in and finding out what actually is wrong. You know, when you're seeing something, going deeper than what was on the face
Yeah.
value, the thing that you're seeing. So then I realized I always had that way of thinking and looking at stuff. So when I got into my own practice where I had patients that weren't getting well, that led me to want to keep digging deeper, like you say, go deeper. And then there's something deeper underneath that. And so that really informed a lot of it. But like you said, you probably like, I used to be good at doing puzzles also, but that was the main thing. I realized the whole detective thing was always my thing as a kid. Those are my favorite shows.
I think our, you know, our gifts, you know, are kind of like always there. And, you know, in our interest, I guess if it's we grow into them enough to understand or understand ourselves. I remember one time, why do you remember these things? You know what I mean? I mean, I remember where I was. So I had to be in like 2nd or 3rd grade tops. And I remember going, you know, I was just thinking about life. You know, I want to know stuff that other people don't know. And maybe I'll tell them, maybe I won't. You know, I just want to know stuff that they don't know. And so why at one moment on the playground, I remember where I was in the playground. I remember probably nothing else from that whole year in my life, literally. And why do I remember, right? Why do I remember that moment? But then when I see like the intuitive piece, right now, I think honestly, only now am I really starting to understand and embrace. And you know, my whole career as a radiologist, right? I mean, when I see, like now, when I see a mammogram and there's a small cancer on there, I'm the only person in the world that knows that that patient has breast cancer.
Wow, just by spot.
Just by a spot. Now, sometimes you don't know, right? There's uncertainties. That's where I think a lot of the intuition comes in. But some of them, if I look and some of them are classic. And I haven't even thought about this till now, but doesn't have to be breast, it can be anything. But let's say there's a cancer somewhere. As the radiologist, I'm often the very first one to know, especially in the breast cancer realm where we do screening, and ideally we find them so much smaller that people can know that they're there.
They can't even feel it.
Oh no, 2, 3, 4, 5 years sometimes, depending on how fast growing it is. It can be easily 3, 4, 5 years before they would know what's that, you know, and I'm seeing it, but it strikes me even now sometimes, you know, I am the only one in the entire world that knows that this patient has a breast cancer. Now, as soon as I do this report, the technologist is going to know, the doctor's going to know, the doctor's going to tell the patient, she'll have to get a bot, right? It's a whole cascade of things that happen, but it's kind of the sacredness to me of what I do.
That is very sacred, especially 5 years in advance before.
Oh,
so
yeah.
what happens to the person that get the diagnosis 5 years prior, because the biopsy would show it as a cancer, that spot.
Yeah.
Okay.
Well, typically, let's say a difference of I diagnose it today at a centimeter, or I diagnose it, or it gets diagnosed. Oh, what's this lump? I'm going to go to my doctor, right? And it's like 4 centimeters. 5 years later, it's almost 100% survivable when we find it early.
Nice.
Almost 100%. And if you find it at 4 centimeters, which is like, that big, maybe 60% survive. I mean, a good number. There's a lot of parameters to it. You can't just pick a number like that, but a fair number will not, because it relates to how big it is. So that's sort of how I describe my job as, searching, it's kind of like scanning the ocean for a survivor in a lifeboat. And I'm just looking for anything that doesn't look like a wave or a piece of seaweed, or you just scan, and that's something. So that's kind of my job. And again, until I'm starting to just now get into the intuitive part of my, and learned deeper about myself, because I've been so, I want to say pigeonholed is not the right word. It's just so inundated in the medical paradigm, and obviously I'm not, or I would have never come to you. You know what I mean? I mean, I'm way more open-minded than that. And I always have been. I've always been curious, and I don't really let artificial boxes stop me from checking things out and learning more. So I always considered myself open, and to a large extent I am, but I never realized until recently, you still have that. It's still easy to be in that box, right? I mean, I always say medical school does more than teach us facts. It teaches us a way of thinking. It teaches us a paradigm that this is the way the world is. And, if you're fortunate, you get out and then life teaches you, oh, wait a minute, it's not that this is wrong. It's that, no, wait a minute, there's more than this. So
it's almost like an orthodoxy.
It is. It's a religion, basically.
It's a medical religion.
It is kind of. You're taught not only facts, you're taught a way to think, and most practitioners never get out of it, because your career is based on, well, let's say, okay, it's the pharmaceutical paradigm, right? You come to me, you have a problem, I know what pharmaceutical to give you, right? That's the general medical paradigm, not for surgery, but for family practice and whatnot. Well, once your livelihood depends on that, if you all of a sudden realize, wait a minute, some of these people would benefit by going to an acupuncturist, some of them would benefit by going to an energy healer, right? They don't necessarily need this drug, and they might have an epiphany, but generally they shut that epiphany down, because the price of following that epiphany is you got to blow your whole world apart. You can't sit there and give drugs all day long if you know there might be a better way. I feel fortunate to be a radiologist, because I never had that. I just diagnosed. What happens to it after that is not my business. I mean, I've learned a lot. I know a lot general about how they treat things. I'm not qualified to treat them, but I know a lot about how things are treated. But I'm not responsible for that. So all of my responsibility is to see it, to make a diagnosis or come as close as I can. And that's all. So what that has left me free to do is talk to patients and tell them what I know.
Have you ever had, like, maybe you looked at someone's film and it looked like something, and you go back and it's like it doesn't make sense when you go back and look at it again if you do a follow-up, or you don't do that part.
What do you mean?
Like for instance, let's say someone had, like you said, they have a spot, and you
Okay.
might be tracking it, and maybe the spot got a little bit bigger, and then maybe the spot disappears or something. Have you had anything like unusual that's like unexplained, or that doesn't really happen?
Um, it does happen. I have not had that. And or at least that I have recognized, because the breast imaging is so nebulous that the breast is, it's not square, it's not fixed. Every time you image it, it looks different, it rolls, right? So sometimes this part of what my intuition has to deal with and subjectivity is, okay, it's there this time, it's not there the next time, but is it there, but it's hiding?
Ah.
And then my decision is, it's hiding behind tissue. Is it gone, or is it really there? And then I have to, do the calculations and go, you know what, it's safe to watch this.
Mhm.
Or you know what, it's not safe, I got to know. And then I recommend they do other things. But I have had a friend who was a technologist who was a very spiritual person, and she saw somebody who had what they call an IVP. They don't even do them anymore. It's years ago. Intravenous pyelogram. They inject dye in your vein, and it goes to your kidneys, and they take pictures of your kidneys. Now they just do CAT scans, but they were doing an IVP, and she could see a mass on this kidney, in the beginning, and she felt like whatever her guides or whatever she was talking to, said, okay, watch this. And by the time the exam was done, it wasn't there.
And she went back and rechecked, and it still wasn't there.
Wasn't there.
Huh.
I have had a friend who had something on her uterus that was by ultrasound proven, and then they were following it, and then she went back to her doctor, it was gone.
Hmm.
So I have heard.
So how does medicine deal with those types of situations?
The quick answer is they don't,
Okay.
because they've done studies on this. Actually, there's stuff written on this, that if you go to your physician and you say, listen, I had this cancer, here it is, here is my x-ray, here's my x-ray today, I've had no treatment, it's gone, what would your doctor do? And virtually always they say, wow, I'm really happy for you, that's amazing. And they might have 3 minutes of pause, right, to, like, I don't know, review their whole life, right? Maybe their whole life passes before them. and then they go on, and they just go back to the next patient next. And
Mhm.
it has nothing to do with the doctors, really. It's a paradigm shift. It's outside of their paradigm. It's outside of their belief system. And they don't know what to do with it. And in order to do something with it, they got to give up their career. They got to give up their livelihood. Who was it? It was Dr. Brian Weiss, I think. I haven't met him, but my son bought me his books for a present. And he's the past life regression guy.
I went to a seminar with him once. Yeah.
And he, I don't know what kind of doctor, I think he was a neurosurgeon, something like that. He had a head injury, or no, he had a patient who was relating all these past life things, and he couldn't ignore it. It blew him away. And he watched this patient basically be emotionally healed, and it changed him, right? He kept with he said he followed it. He said, wait a minute, there's more to what we're doing.
Yeah.
But he had to give up his whole career. He had to change everything.
Yeah. I remember Dr. Weiss. I went to a seminar with him,
yeah.
and he talked about all the case studies that he did over the years, and then he did an exercise with the entire room. I think it was like a couple thousand people in this room, and he had everybody lay on the ground.
Yeah.
And then he started talking, and the next thing you knew, everybody was snoring the whole room. It's like, and then you woke up and Dr. Weiss was done. I was like, what did he do? It's like, it was the funniest thing, because I'm like, yeah, I like miss Dr. Weiss. I don't know what he said.
What happened?
Yeah, and he had a very soothing voice also. He had this very, very monotone, soothing voice, and everybody was gone.
Yeah, you
And
have to
so
leave
yeah.
everything, you have to leave everything you know, because as a physician, your life is built upon that. Your career, your professional reputation, your livelihood, your home, your mortgage,
You're
right?
a member to the society.
Yes. And then in order to go in a different direction, if truth leads you there, then you have like an existential choice to make.
Mm.
And it's not any, I don't judge people for not doing it, because it's just it's an existential choice. What's my wife going to think?
Yeah.
Right? What's my husband going to think? What can I send my kids to private school but wait a minute, this is truth. It's not an easy thing. And as I look back at my career, I feel so blessed to have been a radiologist, because I just diagnose. I'm not tied by any belief system. I just solve puzzles and I tell you what I think. You know what I mean? And that's all I do. And I just, interesting as I look at the rest of my life, it's like, no, I'm just looking for the truth. That's my only job here, is to find the truth. If it's a tough decision, well, your surgeon's going to make that tough decision. But I will lay out the decision for him, and then my job's done and his job starts.
Right.
It has allowed me to really be open and really search other things, because the standard of care for me is limited to the diagnosis. If I see a certain thing, then I have to recommend a 6-month follow-up. If I see a certain thing, I have to recommend a biopsy. Those kind of things. It's just an imaging, or I'll bring them back in a year. So, but most of that's common sense anyway. And it doesn't limit me from finding the truth of how we're built as humans. It didn't limit me from coming to see you as an acupuncturist. I never saw you for acupuncture. I just thought the intuitive stuff was fascinating. And it's either real or it isn't. And if I think it's real, or at least temporarily, it looks like it's real, I will chase it, but I'm not limited. And I feel bad for my colleagues who, right, there are more and more miracles happening this time in the world. They're more common.
Wow.
And like I said, it's an existential choice. I mean, medicine's painted itself in a box, and it can't really expand because the box won't allow it to expand. And the problem with medicine, in my view, is not that they're wrong. The problem is they think their little piece of the pie is the whole pie. This is healthcare, right? This is healthcare. It's hospital, it's, insurance, it's ICUs, it's medications, it's surgery, radiology. This is healthcare. And in reality, it's just their piece of it is what they call, I think it's called allopathic, I think is the conventional medicine, is that it's just a piece of it. And then there's acupuncture, then there's energy, and then there's a whole, it's never ending. It's endlessly intricate and interconnected. It's, and everybody outside of, an acupuncturist, an energy medicine, all those other modalities, they understand how everything's interconnected. But the medical world just thinks it begins and ends with us.
Okay. So what's interesting that they would really hold on to that point of view, because like you said, you can't figure out in biology, like how does the water get up to the top branches of the tree? like how a wound actually heals. We know how to manage it, and like what you said earlier. So
Yeah.
you think those unknowns would give more exploration in medicine? No.
Well, some people do, but usually it's like at academic centers, and it's like in labs that are buried deep at Harvard or something. You know, there are people. It's not like there aren't people chasing that down, but in
Right.
everyday practice,
No. Okay. See what you
no,
said.
it's just moment to moment. Next patient. Um, Let me see. They got a cough. Let me look. Okay, amoxicillin. Okay, here's some amoxicillin. Come
Mhm.
back in a week. Was the next patient. Okay, abdominal pain. Okay, here's another medicine. Okay, come back. And that's like it never ending. I mean, it's never ending. It's all day, all day, all day. And that's what they're trained to do. So they really don't have time, in a sense, you know, to
Explore. Yeah.
explore. They
Mhm.
could, and some people do, but the people that do get
Have to
out of the box. They get out of, and there's price to pay, but they get out of the box.
change.
Um,
Wow. I never, thank you for enlightening us with that, Tom, because I never really thought about it from that angle. I realized that, I'll speak to a medical doctor, he would know what I'm talking about. Like he'll have a concept of, yeah, that makes sense. Because you don't just live in the box of medicine, you live in the world also. So you have exposure and you have knowledge of various things. But I didn't realize that it was that rigid as
it's
far as
it's
especially in
rigid.
this day and age. You would think it would have been a little bit more open with
Now
every.
around the fringes, yes, it's changing. And it's way different now than it was 10 years ago. And I wrote my book 10 years ago. You know,
Mhm.
I was afraid who was going to read my book, you know.
Okay.
But now there are more, the alternative, complementary, holistic is around the edges. It's much more accepted,
Okay.
you
And,
know, and
and maybe like functional medicine and things like that seem to be creating a bit of a bridge.
oh, absolutely. Yeah. A lot of doctors are, well, my functional medicine doctor, the only one that I go to in town, was a former ER doc.
Hmm.
And she had this epiphany and didn't want to do that anymore. So now she does functional medicine. She's magical and she's busy all day long. So
Nice.
there are more around the fringes, it's happening, but it's not, it's being driven by society, which is kind of sad when you think about it. Is medicine is not leading, we're behind. We're only changing because patients, if it's strictly conventional medical paradigm, you come in, I'm going to give you a pill, those things are becoming less popular. The people that branch out into doing supplements, IVs, more natural things, they're busy all day long. So the society is changing it. Medicine is still kind of trying to hold on to that box. I don't think it's ever going to voluntarily let go.
Okay. So it'll reach what they say a critical mass where it change. And I just want to hold up. This is hopefully we'll get it out of the glare. This is your book that you wrote when we first met in Orlando. And it's a very good book, but like you said, you were a bit apprehensive about people in your profession finding out that you even wrote this book. Tell me a little bit about what
Yeah.
that was like.
Well, it was, I'll just give you a quick progression of how it happened, because I was, again, my profession drove me into it. And it was because I would read mammograms and I would have to tell the patients, I'd have to tell, hey, listen, I think something's wrong here. And I have to explain it to them. I think you need this other test. And then I'd do the biopsy, and then I'd be the one who had to tell them they had cancer. So, which is, it's heartbreaking, but it's also, it profoundly changes you. And it's very gratifying because depending on how you do it, there's all kinds of different ways you can really soften the blow and whatnot. So it's difficult. And yet I love the opportunity to have that, be at that place in somebody's life to make that, as palatable as it can be. But so women started asking me questions like, what's causing this? And I would say, we don't know, which for 1990 or whatever was true. That's it. We don't know. Is there anything I can do about it? I know my doctor is going to take care of everything, but what can I do? And I said, well, nothing. We don't know about anything. And then, which I was telling her, absolutely state of the art. That's what the knowledge base was. And then literally I thought to myself, well, you know what? After doing that for a period of time, I thought, you know what? Maybe somebody knows, maybe just I don't know. So I started doing research. They just got me to be curious. I'm telling people I don't know, or we don't know. Maybe somebody knows.
Okay.
So I started doing this research, and oh my gosh, no, people do know, and they did know. Like if you exercise like 4 hours a week, I think, this is just off the top of my head because I wrote the book, so it's all in here. If you exercise like 4 hours a week, you cut your chance of risk, you cut your risk of breast cancer by 50%.
Wow.
Just by walking, not even going to the gym, just by walking 4 hours a week, your breast cancer risk gets cut by 50%. And there's other things too, like that holistically, like diet is a huge change, like percentage of the risk of breast cancer in third world countries is like non-existent. But in the US and modern countries, it's skyrocketing, right? So it has to do a lot, they think, with pesticides, a lot with the modern diet. But so that's what once I started down that rabbit hole, I couldn't stop because oh my gosh, I can't believe oh my gosh, somebody knew this. How come they're not telling us? That was my next question. I'm reading it here in the literature. It's the medical literature. Why aren't they telling us at our medical conferences? So again, getting back to the other, because I was in diagnosis, I was free to go down that rabbit hole. I didn't have to make a choice like, oh my God, I got to give up my job if I chase this down. So I basically went through all of the things that you can do for yourself, either if you have breast cancer and you don't want a recurrence, or to decrease your risk. And it's all everyday stuff, meditation, talk about imagery even, and just general healthy diet, that kind of thing. But when I came out with that was like that was outside the box. And, I never had a colleague, huh?
And that was only 10 years ago.
That was only 10 years ago. I never had a colleague say, I never had him say anything to me, but I was very cognizant of that when I was writing that, to not be too critical, to be very careful what I say. When it was written for patients, it wasn't written for my colleagues or for doctors.
Right.
But I guess it's just another example of kind of going down that rabbit hole.
So that is really interesting, that you telling your patients you didn't know, to these basic questions like, what should I do about it? Is there anything I could do to help myself? And I really don't know. And then it was all in the medical literature. Probably there.
It was like, I don't know. And then it was, we don't know. And then it was, maybe somebody knows.
But then what's interesting is that you said you were able to find all of this in medical literature. And, so I'm thinking you're doing like journals, peer review stuff written for the medical profession, that all of this stuff was already there. And how long was some of these things written?
10 years.
More than 10 years. So 10, 20 years prior to you doing the research was already there.
I was mad.
Yeah,
I was mad.
Me off too. Like, this has been here all this time and nobody told us. Here's
another thing that really got me was
since you started medical school, that stuff's been there.
Yeah, it was there all along. They make such a big deal about family history of breast cancer, right? Oh, your mother had it, your sister had it. I mean, it's true. It's not false. But it's such a big deal. Oh my gosh, they'll take your lifetime risk and they'll calculate it by all these by 30 different parameters. The problem is, in reality, it's 130. They don't really know. But all this family history stuff, all this family history stuff. Then I learned that 75% of breast cancer has no family history.
Wow.
3/4 has no family history. And again, I'm like mad. Well, then what are we doing? What are we telling people?
That sounds almost like a conspiracy now. Patient's been there. We're telling them something. The data is all off by more than 75%.
Well, when you get, along my, I mean, I'm not generally a conspiracy person, but there are conspiracies, on some level, but about something. But along my research and my learning, I found out, oh, you mean 75% of the funding of medical schools comes from the pharmaceutical companies. That's interesting. Who decides what we get taught? Because I remember, see, this is where I'm just fortunate. I just feel so blessed to be where I'm at, and I realize, had I been brought up differently, I couldn't be here, right? Because I never, especially wanted to be a doctor, didn't care, wanted to play baseball. That's all I knew, So I came into it. I didn't know anybody who was medical, nurse, nothing, not a friend, not anybody. So I had no preconceived, notions about any of it. And so it allowed me, when I went to med school, it allowed me to really have an open mind. And I remember saying, well, why don't you get a chiropractor in here? What do they do? I mean, literally, I had no clue. I'd never been to a chiropractor. You just go to your doctor. What do acupuncturists do? Why do they stick the needles in there? What does that do? I knew nothing about energy. But I asked him, why don't you have them in here? Okay, you think they're all quacks. That's fine. Call it Quack Day and have everybody else in and tell us what they do. They've been there for hundreds of years practicing. So if it was totally worthless, don't you think it would have died out? Right? Somebody's finding value in this somewhere. So, but no, they're quacks. No, we don't do that. Now, this was a long time ago, and most of my professors, as I look at it now, went to med school in the 1920s, right? Some of them in the 1920s, 1930s. So these are the guys that were teaching us. And I say guys because almost all males at the time. And so even though we were at even a more modern place at the time, you can see where the old views really get passed down. They really, really get passed down. And it is just not only a way of thinking, but it is an ancient way of thinking. And it was a very 1930s way of thinking, in terms of all of it. And this is what you do, and you do not ask questions. And we are not having those people in there. They are no good. Trust me. That's why I say it's almost like a religion. It's like, trust me, you don't want those people in here.
They're like the heathens.
They're like the heathens, exactly. But now it's much different now. I mean, acupuncture is pretty close to, I think insurance covers some acupuncture. Of all of the holistic things, acupuncture has made more inroads into conventional medicine than anything. Even chiropractic has made some. But still, it's just never gonna, just the way it's set up in a capitalist society, what I mean? It's never going to make more than just minimal inroads as long as the system stands, as it is. And we were talking before about like intuition in medicine, right? Like kind of what we were, talking about is that you don't do that. You don't say that. You don't.
You're being very bold, Dr. Tom. That's the title of this show.
Yeah. You don't say that. There's a standard of care and you have to do this. You can't just say, my guides are telling me this and I know it's right. Luckily for me, I've been like a clueless intuitive because I don't think I really was connecting, that I just knew what to do, but it still had to be within the standard of care. But there's a broad range in standard of care. There's a broad range, right? And a lot of times you just I look at a case and I just know, look, she's fine or she's not fine. It's like, and sometimes the standard of care forces me to do something I don't really want to do. Now, for me, it's usually get an extra x-ray or call her back for an extra picture. So it's not so onerous. But
so when you were saying about intuition in medicine, I remember reading, it might have been in a book or article, because I've read so many things over the years, just doing my own research. And I remember they were talking about nurses and how intuitive they were. And a nurse could be at the desk on the floor, and then she would, before the bell would ring, she'll say, room 311, go check on room 3. She'll just know and send one of the nurses or go check on that room before, and the person might be under some distress and all of that. And they were like, how did that nurse know? Like, they could pick up on that stuff. So they're using their intuition, but nobody's telling them that's an intuitive thing to do.
Right. I think it's easier for like nurses because they're really the caretakers of the patient in the hospital. Mm-hmm. They're with them 24/7, and the doctor will come in to do their rounds. I mean, we take care of them, but it's in a different way.
Yeah.
It's sort of like we oversee the care, right? Mm-hmm. I say we, I mean, I'm not a, hospital physician, but the hospital physician makes the decisions. We write our orders, do this, do that. And then the nurses take care of it, but they're with the patient all the time. They know them. They know their dog just died. They know their daughter just got a divorce. They know, what I mean? They can read them. It's more ripe for an intuitive connection. Mm. And the physicians don't always have that because the time is so short. And again, they just can't, it's sort of drilled out of us. It's like, you don't do that. You just do data. It's data. And it's fine. It's not wrong, again, but it's only one segment. It's only one piece of reality. Mm-hmm. The whole medical thing is based on surface material, mechanical reality. And when you go one step deeper, you're in a world that can't be measured. Right? You can feel it, you can understand it, you can follow it and go, oh my gosh, I'm glad I did that, but you can't measure it. So it's so anti-medical. You just don't ever dare say it. I'll give you one quick story. I don't know how we are on time, but
we're almost there. We got to talk about your next book.
Okay.
Mm-hmm. But go ahead.
Then I just had a surgeon one time who I broke my clavicle, and they tend to not heal. And he was going to put a screw in it, and he just said, you know what? Because I'm healthy, I worked out, I ate very well. He knew all that. And he says, let's just watch it. And I thought, that's odd. They never heal. They're supposed to put a screw in it to fix it. It's just my clavicle. Okay, it'll hurt at the time, but it'll be fine one way or the other. And he just said, let's just see. And 6 weeks later, it healed on its own.
Wow.
And I asked him, I guess just being who I am and curious, I thought, he just knew. That was not his standard of care. He should have put a screw in that. And I went back and I asked him, I thought he was fantastic. He's the best surgeon in town in my book. I always send everybody to him. And I thought he knew somehow. Something told him I didn't need that surgery, even though the book said to have the surgery. And I asked him when I went back, and he wouldn't tell me. How many of those actually heal? I don't know, a few. He wouldn't be pinned down. And I laughed. I didn't push him too hard because it's like, no, he cannot afford to do that.
Yeah.
And he probably felt safe with me. I'm a friend. I'm another physician. I'm not going to sue him, but I think so he was hiding. I felt like he's highly intuitive and he had to hide. And I think that's how intuition largely happens in medicine. There are areas where you can use it, you know what I mean? But there are areas where you got to just be careful.
Mm, wow. That you've really opened up my eyes. I always knew there was a resistance
Yeah.
there. I didn't realize it was that deep and that almost dangerous.
Yeah. It's brainwashed out of us in medical school. And if people kind of start to awaken and go down that path, there's a penalty for going down that path.
Mm. Wow. If
Or
didn't
you
know
just
before, now
you
you
just
know.
do it like me and you're clueless that you're doing it.
Mm-hmm.
You don't even know.
Yeah. And
You
then
just,
that's your safety.
that's my safety.
Or like your doctor, your surgeon with the clavicle, he just does it and then just brush it aside like that
Yeah.
was nothing. Nothing to see here, man.
Nothing
Keep
to see
going.
here. Exactly.
Wow. Wow. That is really, you've really, really enlightened me about how this whole system works. Because when you're on the outside, you come up with speculations. Why don't they want to do this? This would make so much more sense. It'll probably make their lives a lot easier. They could just be themselves and, find ways to, make the medicine, all their learning and knowledge work together. But like you said, this is just a no-no.
And they don't see it. That's from where you guys sit. It's like, yeah, well, why don't they do that? This is so obvious. They must be greedy or they must be this or that, and all which may be true. But it really is a blindness. It's an inability to see outside of the box.
Yeah.
It's really a blindness. They don't know the doctor who's sitting there just giving out pills all day are taking care of their patients in a manner of speaking within the paradigm, and they're taught that's how they do it, and that's all it really is. And the other stuff that you do and all of that is kind of mumbo jumbo. It's not proven, but it's a blindness.
And it's interesting, like you said, even with all the research, like you said, some of this research goes back 20, 30 years. And, it's not even highlighted in any way. That, we have this, go to the research books and see what has been done or what has worked outside of the convention.
Right.
So,
why wasn't I told? Why did I have to go chase that down?
yeah, that was already there. That's amazing. So one of the things we want you to do for us, because this is such an interesting conversation. I know that you're working on another book. The Journey to Hope was your first book that you wrote specifically for patients with breast cancer. And you have a lot of these patients come to you now because, you're either working with them in what kind of capacity outside of just imaging.
Well, it's for anybody. It's for all women. I initially wrote it for women who were at high risk, feeling like there's nothing they can do. Okay. But it sort of got put out as a breast cancer book. But anybody who's dealing with any of that, I can sort of help walk them through it. There's a lot of fear about breast cancer all the way from beginning to end, especially the breast image. Oh, I had a mammogram, I got called back. Well, what does that mean? Are mammograms any good? Are thermograms any good? Don't they cause cancer? I can kind of answer all those questions, So I really help them sort of deal with their fear and help them sort of come to a decision. Do I want this biopsy? Do I not? Am I safe to wait? Am I not safe to wait? I can help them sort of wade through all that.
Okay. So how, with this new book that you're in the process of writing, or you're going to be finished, you're almost done with this new book that you're writing?
It's just about done. It'll be out in October.
Okay. So is there, so tell us what inspired you to do this new work with this book?
I started writing years ago, and as I see it now, it's always been intuitive writing. Just like you see thing, you do it verbally. I realized that I was doing it in written form.
Mm.
And I would sort of see things and I'd write it down. I'd know things, something would come to me and I'd have conversations. I'd just start writing. And so I've always been doing that. And I would send it out to friends and different people, and they would always get a lot out of it. They seemed, here's was a discovery I made. When I saw something emotional, whatever it was, somebody died, somebody was sad, something happened, they were super happy, whatever I wrote about, when I gave it to them, I realized, wow, they feel it. They really feel it just from what I wrote. And I realized later, oh my gosh, I'm doing the same thing I did in my career. I see it, I describe it, and somehow I'm able to communicate so that when they get the written page, they see it and feel it too. So I was encouraged by it, and I guess I've always been looking at something deeper. That's really how I've always, even the breast cancer piece, it's like, okay, I diagnose it, but wait a minute, there's more to it. What's below this? What's beneath this? So this new book is really just about life. It's not about breast cancer. It's about the deeper things of life. Wait a minute, the piece that you have is like, wait a minute, I hate making mistakes. Well, why? What's wrong with that? I'm going to make them anyway. Wait a minute, what's that? So, and I follow it down to, I just follow it deeper. And the more I sit and I just get quiet and these things come to me and I just write them down. And it's just about everyday life. There's one about being disappointed, one about frustration, one about your family, one of just stuff, everyday life. There's always deeper connections. There's always something deeper going on than the thing on the surface that we see. I'm mad about this. I'm happy about this. I'm disappointed about whatever. If you stay with it, it's a lot deeper than that. And that's what the book is. It's just a collection of different writings of mine from everyday, it's called Something Deeper, and the subtitle is Life or Lessons from Everyday Life.
Nice.
And it's not medical at all. Some of it's my medical experience, something that happens during a workday, but it's not specifically at all medical.
That's really nice. It sounds almost like a book where someone could read it and like a daily reading, a daily meditation, a daily devotional, some kind
Right.
of.
There's 31 of them, 31 of my writings, one for each day of the month.
Good.
And then they stay with one a day, hopefully, because it's not like a regular book. You don't just read through it because they're deeper. It takes time, and then it percolates, and then the next month you start over again, because it changes you. It changed me to write it. I learned a lot about myself. I learned a lot about the world just through these intuitive writings. And my hope is other people will be changed also, right, by going through the same experience that I do. Wait a minute, I'm frustrated. What's that all about? What is frustration? What does that mean? What am I, and you start looking deeper at these things and you realize, wait a minute, I'm not even aware of what I'm doing half the time, right? As humans, often we're not. So it's about self-awareness. It's about becoming more whole, and you just reread them, and as often as you want. And then there's exercises in the back for going deeper.
That sounds like an awesome book. And so in October, that's the first time they could get it. So if people want to get the book, we're going to put a website, a way to get in touch with you.
Yes. My current website is yourjourneytohope.com. That's what I wrote. That's the website for when I wrote the book initially. It's very old, but it works. And within the next 6 weeks, I'll have a brand new website, drtomhudson.com. But the link that you have will take you to yourjourneytohope.com. And if they want to be notified when the new book comes out, just leave your email.
Okay.
There's a place to contact me. Just leave your email, say, let me know when the new book comes out. And it'll be open, it'll be out for pre-sale maybe September probably.
Okay. So what I could also do is that when you update to the new email, the new website,
Yeah.
I could always change that link in the description box for you. So if you send
Oh,
that,
perfect. I'll send it to you when I get the new one. Yeah.
mhm. And then we could just edit out that link, and so they'll have that, whoever sees that, and they could always come back to that in a few weeks.
It'd be cleaner than give me your email and then I email you when the book's out. You know what I mean?
Yeah, so then,
Do it.
yeah, I'll put the link if anybody wants to reach out to you, want some more
Yeah.
information for you. I'll put your Journey to Hope, I'll put that in there, and then when you get the new website up and running, we'll put that link in there.
Yeah. Okay.
So then we'll do it. Wow, this was a really interesting, I learned a lot. I learned a whole nother perspective. You know, like sometimes, like you said, you're on the outside looking in and you're like, wonder why they're doing that. This will be so much easier. Things will just work better. So you're thinking on your end and you're trying to figure it out. And you're like, no, we're terrified. You know, it's like, it'll be like the Inquisition if we make a move. It's kind of crazy.
We don't see it. And if we do see it, we're terrified.
Yeah, that's what I mean.
Yeah.
Nobody would have ever brought that perspective to it. So I really thank you for that.
Yeah.
Is there any, I always ask all the guests, is there any parting word of wisdom you want to leave people with today before you go?
Wow. You know, I guess just that as I go more through life and even look at my old book, I haven't thought about my old book for years. It's been 10 years. It's just that there's always something deeper. There's just always something beneath the surface, whether it's you or them or an event or whatever. I mean, my new book is so related to what I did in the old book, and I had no idea. I didn't even know. So it just there's like healing there, and it's anywhere, really. It's an everyday event. Look at the tree. Can't figure out how the water gets from A to B.
Yeah.
Right. There's a message in that. So I guess that's my overall message.
That is really, and thank you so much, Tom. This was incredible. Appreciate it.
Okay. Thanks, Akia.